Hello everybody who speak English in our school. This little video is to introduce all of you into the new workshop, the Mpr Fundamentals. We will start in the month of June in collaboration with the Spine Action, who is our partner in India, who organize all our courses there. And this is the third time we being there in India, for the first time in India with the Spine Action, in this new course of Mpr Fundamentals. I would like to introduce our school. His name is Mpr International School. We teach all around the world. Medical doctors, dentists, physiotherapists, and osteopaths to work together, treating the patients in neuromuscular rehabilitation. That means we teach an interdisciplinary protocol to speak the same language, all of them in diagnosis, planning treatment, and therapy. This is my little CV. I am Professor Di Rocca, the director of the Mpr International School and the creator of the M.P.R protocol. I start with this protocol 40 years ago, many years, teaching people all around the world in 3 different languages, in English, Spanish, and Italian, to prepare the medical science who work in physical rehabilitation to work together, understanding each other when they treat the patients. And what is the Mpr? Mpr is a protocol of action in an interdisciplinary way. What I mean? We prepare people to see the patients in the same point of view. If you look at the patient with the same point of view, it's very easy to work together, even if you are not in the same place. This is the real concept in Mpr, in myofunctional postural rehabilitation. When we are talking about a real physical rehabilitation, we talking about the good balance between the craniofacial system and the tonic postural system. If we can obtain that situation in our patients, we will have a good balance into the muscle change, and our rehabilitation will be perfect, and they can go through the time without any relapse. Mpr is a method of diagnosis and treatment in neuromuscular skeletal dysfunctions for all health sciences. The objective is to obtain a good balance into the whole body. If we can release that, our rehabilitations will be. Craniofacial system is a particular system. When it is in balance, it will not disturb the rest of the body. But if we have a craniomandibular dysfunction, it will affect our posture through the negative action into the muscle change, and it will not allow us to do a good, real and permanent rehabilitation. A good balance into the craniofacial system is when we have a good central relationship of the jaw that is not affecting the balance of the whole system. When the jaw is changing the position, is changing the exactly right position, it will affect the rest of the body. And I will try to show you in this little video how that's happened. And that's very important to understand for all medical science, mainly for people who are doing the physical rehabilitation. That's a very important concept that we have to understand to treat our patient. To obtain a very good physical rehabilitation, we need an interdisciplinary protocol of action. This is absolutely necessary. And that is only possible if the whole medical science speak the same diagnostic and therapeutic language. That is in absolutely MPR. This is the concept of MPR. The MPR is exactly an interdisciplinary protocol for all medical sciences. In that way, all of them can communicate each other and can treat the patient with the same point of view. It is a diagnostic and therapeutic method which acts in physiological and natural way, as you will see during this video. And remember, exactly MPR is a good balance between the craniofacial system and the postural tonic system. That means a good balance of whole body. This is the goal in rehabilitation, to have a good balance in the whole body. And what is MPR exactly? It is a diagnostic and therapeutic protocol that use tools of the different medical sciences, and the purpose is to obtain a good balance into the craniofacial system and the tonic postural system. That is synthetically the MPR. We said that it is an interdisciplinary protocol because it is active that may adapt in the evolution of the patient in any stage of the treatment. It's integrated because specialists intervene with the same diagnostic and therapeutic approach. And it is an interdisciplinary because various disciplines work together to treat the patient with the same point of view and the same approach. And the M.P.R, it is myofunctional because it's working in a physiologic neuromuscular and skeletal balance. It is postural because do the rehabilitation of the whole body, and it is a rehabilitation because obtain the balance of all systems of the body. That's why we said it is a good rehabilitation. And the concept of M.P.R is to obtain a balance in the triangle of health. That means the mind, the structure, and the biochemistry. If we obtain this, rebalance the whole body, we will obtain a good rehabilitation. And we will do that using the deprogrammation of the systems to obtain a good physical rehabilitation, and then to reprogram the systems that they needed, only the systems that they need. And to obtain this, we will do a clinical diagnosis, an instrumental diagnosis, and a complementary analysis of the body. All medical science protocol do that: clinical diagnosis, instrumental diagnosis, and complementary analysis. Clinically, we will study, we will investigate the oculomotor system, one of the main receivers of the posture. We will do a total postural analysis and a craniofacial system diagnosis and a foot support analysis. With that, we can obtain a good holistic diagnosis of the patient. Instrumental diagnosis with the posturometer. We will study posturometry and stabilometry of our body, a good measurement to analyze our posture and to investigate if the receivers of the tonic postural system are there in balance or not. With this, we can arrive to the root of the problem clinically and instrumental. And then the last analysis is the food hypersensibility and the amino acid deficit. With this, we can have a total picture of the problem, and then we can do a good planing treatment. And then we will study the tools of M.P.R, the tools for deprogramming and reprogramming. To deprogramming the oculomotor system, the craniofacial system, the podal support, and the biochemistry, and also to reprogram them if it's necessary. Those tools you will learn in the M.P.R Fundamentals workshop. The tools for the programming and reprogramming will be the magnetic fields exercises, and also, as you will see, some manipulations of osteopathy. Those are the tools for deprogramming and reprogramming the system, the oculomotor system, you will learn in the fundamental workshop. You will learn some particular tool with the bed, the body equilibrium device, a very perfect tool to do the deprogramming of the one of the disturber, the biggest disturbers of the postural system, that is the craniofacial system. Also, I will teach you the use of the insoles for deprogramming and reprogramming the foot support that is very important receptor in the posture of the body. And finally, you will learn all the tools you need for the biochemistry, for deprogramming and reprogramming our body in the neuromuscular skeletal disease. With these tools that you will learn in the fundamental course, you will be able to treat your patients in the MPR way. I will show you some patients that you can treat with the MPR protocol. The functional scoliosis, where you will see, as in this patient, is connected the craniofacial system, the foot support, and the biochemistry. This is an adaptative scoliosis. You will treat all postural disease with MPR, but you can prevent in child to do not arrive like this as an adult with the problem. Prevention is the best way. You can see how annulating the craniofacial system, the body, is rebalanced. And you can see how with the bed you can obtain good solutions. And you can treat a lot of patients like this, a lot of patients with postural disease, a lot of patients with several problems that it is impossible to treat them separately. You have to treat them with an interdisciplinary protocol, all of them. It is impossible to treat these patients with only one tool or with only one discipline. Real scoliosis like this, you can approach patients with the oculomotor system dysfunction, craniofacial system dysfunction, and posture. You can treat patients who do not arrive like this patient with a lot of surgeries. If you prevent that situation and you treat that situation at the beginning, they will never arrive to surgeries treatment. And that is important to understand. All these patients will be treated with the M.P.R protocol and the MPR concept. And remember, we wait for you in our next course. This is also the other courses you can learn in MPR in our school, but the new coming is for the third time in India, in our virtual room, totally online, this special and particular fundamental course of MPR. We have there the lines to contact, the people to contact, and just to register in this particular course. I will hope I will see a lot of you in this new workshop. And then I have to say you bye-bye. I hope you will enjoy the MPR concept, and I will see a lot of you in our school learning with us and applying our protocol. That's our point. That is our vision of future, to see a lot of people to learn the MPR protocol and to apply them into the neuromuscular skeletal disease. See you in the next transmission, and I hope you have a nice day enjoying the day, everybody.